Hi everybody, I am Dr. Pradeep Shenoy, consultant rheumatologist addressing you from Amrita Center for Rheumatic Diseases, which is located opposite to KMC Tower in Bangalore. In last videos, I have discussed about latent lupus, lupus-like illness, major organ lupus and minor organ lupus. In this video, we will look into how to live with lupus. Once a patient is diagnosed with lupus, usually ladies, the male is to female ratio of SLE is 1 is to 9 to 15. So, if a male gets lupus, only after 9 to 15 ladies succumb to SLE. So, most of the patients with SLE are ladies. But a man, even when gets a lupus, prognosis is quite bad, especially if the man runs into lupus nephritis, the prognosis is very bad. Once the patient is diagnosed with SLE, that is systemic lupus erythematosus, the patient has to accept the illness and accept the medications. This is because the most common cause of flare of SLE is non-compliance with the medications. So the patient has to tailor make the routine in such a way that she can consume the medications on time, not the other way around. Second cause of lupus flare is infection. So here the patient has to be up to date with the non-live vaccination against shingles, HPV virus, flu, that is influenza and pneumonia, and the patient has to be treated with or given prophylaxis antibiotics or antiviral agents before procedures like dental extraction, and the patient has to wash the hands every now and then before consuming the food and after doing certain activities. It is also very important to keep the surface clean at home. One has to clean the surfaces at home at least once in 2 days. Then, if the patient goes out, try to eat healthy, that is, not eat the street food. And if the patient comes to know that if somebody is sick with a contagious disease, please go and visit the friend. So it is advisable to not to visit the patient with communicable diseases. Now, thirdly, sunlight is the cause of flare of lupus. So the patient has to shy away from the sunlight. Don't go to the sun between 12 p.m. to 4 p.m. Wear a full sleeve dress and wear a sunscreen agent which has got sun protection factor of 30 plus. And you can use an umbrella as well while going out in the sun. In the house, one can use sun tinted glasses for the windows. And if the patient goes into the mob, the patient can wear a mask. This can prevent the infection as well. And as far as the pregnancy is concerned, the lupus has to be in remission for continuous 6 months before the conception. And the patients with lupus, that is the ladies, are advised not to take the oral contraceptive pills which contains estrogen, because estrogen is a root cause of flare of lupus. So try and shy away from oral contraceptive pills which contains estrogen. It is very important to avoid the stress also. Stress also is known to cause flare of lupus. Both physical and mental stress has to be avoided. Eat very healthy, nutritious foods on time, and patient has to sleep for 6 to 8 hours, and mentally the patient has to be relaxed. Patient should learn to say no. If somebody asks for an unprotected sex, say no. Somebody asks for an outright poverty, say no. So whatever is not advised by the rheumatologist, that is the treating doctor, the patient has to say no. In the sense that if somebody compels against the doctor's advice, the patient has to say no. So this is what is meant by learn to say no. And the patient could have an eye on associated diseases that we will take care: hypertension, diabetes, accelerated atherosclerosis, osteoporosis. All those things treating doctor will take care. But you should support the doctor by obliging whatever he says. Only then there will be a meaningful treatment for lupus. And if the patient is having lupus for more than 25 years, recently I have started telling them to practice step 2 and step 3 of AA, which I have picked up while working with NGOs. That is surrendering to the higher power and to make a decision to turn your will and lives over to the care of God as you understand Him, for which I have to define the higher power scientifically and spiritually. Then I have to learn and teach the patients how to attain a direction by accepting the God's will. That is the third step of AA, which subsequently I will share in the next videos. I hope this small bit of video will definitely help you in living with SLE. Thank you.